CSCS mock exam, 10 questions. Question 1. What should you do if the toilet on your worksite doesn't work and is always in a messy state? A. Avoid using the toilet. B. Investigate and try to fix the problem. C. Leave the site on your break and use the toilet in a nearby shop. D. Speak to your supervisor about the problem. Question 1. Answer: D. Speak to your supervisor about the problem. Hint: your employer is required by law to provide adequate toilet facilities. Inform your supervisor and let him handle the situation. Question 2. What should you do when you're cleaning up dust after completing a task? A. Ensure you're wearing your protective mask. B. Ensure you dampen down the area. C. Ensure there's adequate ventilation. D. All of the above. Question 2. Answer: D. All of the above. Hint: your first priority is to protect yourself and others that might be affected by any dust created. Question 3. Why is it important for you to control and minimize dust from getting into the air? A. Constantly inhaling dust particles can cause lung problems in the future. B. Less dust means less cleaning up afterwards. C. Dust is always in the air and it does not cause harm. D. Dust in the air will affect your vision. Question 3. Answer: A. Constantly inhaling dust particles can cause lung problems in the future. Hint: inhaling dust can cause severe and even fatal lung problems. Question 4. What should you do if you're given a tool which has a broken electrical wire? A. Ask one of your colleagues to try and fix the problem. B. Get some electrical tape and cover the exposed wire. C. Stop using the tool and report it immediately. D. Carry on working but avoid that particular area. Question 4. Answer: C. Stop using the tool and report it immediately. Hint: if a tool is unsafe for work it should be reported immediately. Question 5. Disposable masks should be used no more than A. 7 working days. B. 9 working days. C. 1 day or 1 shift. D. 10 working days. Question 5. Answer: C. 1 day or 1 shift. Hint: disposable masks are similar to disposable earplugs and should not be used more than 1 day or 1 shift. Question 6. For maximum protection when using a mask you should A. Ensure you're using the correct type of mask for the job. B. Ensure you're wearing the mask correctly. C. Ensure you've passed a face fit test for that specific mask. D. All of the above. Question 6. Answer: D. All of the above. Hint: to ensure you're protected, you'll need the right mask for the job. You'll need to wear it as recommended in the instructions and you will need to make sure it fits correctly. Question 7. Before starting your shift you're given a dust mask that's too big and keeps falling off. What should you do? A. Ask for a mask that fits securely and wait until you have the correct RPE before starting. B. Ask your colleague to borrow his mask then carry on working. C. Carry on working and get another one after your shift ends. D. Carry on working with the big mask until you can get another one. Question 7. Answer: A. Ask for a mask that fits securely and wait until you have the correct RPE before starting. Hint: you should never start working until you have the correct PPE/RPE for the job. Question 8. Being constantly exposed to loud noises can cause permanent ear damage. Can this be reversed? A. No, ear damage cannot be reversed. B. Yes, eventually your hearing will return to normal. C. Yes, you can have a simple operation to reverse this. D. Yes, staying away from noisy environments can slowly reverse this. Question 8. Answer: A. No, ear damage cannot be reversed. Hint: permanent hearing loss cannot be reversed so care must be taken by using correct PPE. Question 9. Hand-arm vibration syndrome or vibration white finger can be described as A. A severe rash on your arm that's caused by exposure to hazardous substances. B. A sign that your hands are on the way to becoming permanently injured. C. An airborne disease that can affect your breathing. D. Frostbite that can lead to permanent damage to your arms and fingers. Question 9. Answer B. A sign that your hands are on the way to becoming permanently injured. Hint: hand-arm vibration syndrome or HAVS is an early sign that your hands are on the way to becoming permanently injured. Question 10. If you're required to use skin barrier cream, when should this be applied? A. At the end of your shift. B. Before your shift starts. C. This should only be used if you can't find your gloves. D. This should only be used as part of first aid treatment. Question 10. Answer B. Before your shift starts. Hint: skin barrier cream should be applied before your shift starts.